we want you to know.
Hi everyone, welcome to our channel, where we bring you the latest research on nutrition, healthy eating, and living well. Today's topic is one that many of you have requested, and since it affects so many people, I thought it would be a good video for me to do on this channel. I'm going to talk about colon cancer. What is colon cancer? What's the risk? What are the symptoms? How do you screen for it? What are the treatment options? And lastly, how you can reduce your risk of getting colon cancer. So let's get right into it. The colon, or large intestine, is the last part of the digestive tract. Its job is to absorb water and nutrients from food and store waste until it leaves the body. And yes, the appendix is part of the colon. Colorectal cancer, also called colon cancer, happens when abnormal cells in the colon or rectum grow out of control. Colorectal cancer often begins as a small growth called a polyp. Not all polyps are dangerous, but some can turn into cancer over time. That's why doctors recommend getting a colonoscopy to remove any polyps before they turn into cancer. Cancers usually start in the right side of the colon and tend to look like mushrooms. So who gets colon cancer? Well, it can happen to anyone, but some people have a higher risk than others. The chance of getting colon cancer increases with age. Most cases occur in people older than 50. Rates of colon cancer in young adults are increasing, but doctors aren't sure why. There may be links between diet and lifestyle. Here's an interesting fact. Some people inherit faulty genes that increase their risk of getting colon cancer. If a parent, sibling, or other close relative has had colon cancer, your risk of getting colon cancer goes up. This is called a family history. People with certain inherited conditions, such as Lynch syndrome or familial adenomatous polyposis, FAP, are at higher risk. And lastly, certain lifestyle factors increase the chances of developing colon cancer, including eating a lot of red meat and processed foods, smoking, drinking alcohol heavily, not getting much exercise, and being overweight or obese. Finally, people with medical conditions like Crohn's disease or ulcerative colitis also face increased risk. Now let's talk about warning signs. Symptoms. Colon cancer can develop silently, especially in its early stages. That's why it's sometimes called a silent killer. But there are warning signs to watch out for. Be alert for changes in your bowel habits, like diarrhea, constipation, or narrowing of the stool that lasts longer than a few days. Blood in the stool. It may appear bright red or very dark. Any poop that looks tarry or black may contain digested blood. Persistent abdominal discomfort. This includes cramps, gas, or pain. A feeling that the bowel doesn't empty completely. Unexplained weight loss and weakness or fatigue. Often, this is due to hidden internal bleeding. Remember, just because you have these symptoms does not mean you have cancer. However, you shouldn't ignore them. Any persistent or unusual changes in your digestive system should be checked by a doctor. How is colon cancer diagnosed? Early detection is key to successful treatment. When it comes to detecting colon cancer, there are several tools at our disposal, each offering unique benefits. The most common and widely used method is the colonoscopy. During a colonoscopy, a thin, flexible tube with a camera is inserted into the rectum and guided through the entire length of the colon. This allows doctors to directly visualize the inner lining of the colon and identify any abnormalities such as polyps or cancerous growths. One major advantage of a colonoscopy is that it's a both diagnostic and therapeutic tool. Not only can it detect potential issues, but it can also remove small polyps during the same procedure, reducing the risk of cancer development. To prepare for a colonoscopy, you'll need to follow a clear liquid diet for a day or two beforehand. This helps to cleanse the colon and allow for better visualization during the procedure. You'll also need to take a medication to help relax your bowel. During the procedure, you'll be under sedation, so you'll be asleep and won't feel any pain. After the colonoscopy, you'll need someone to drive you home as you won't be able to do so yourself due to the sedative. Another screening test is the fecal occult blood test, FOBT, or fecal immunochemical test, FIT. These tests look for hidden blood in the stool, which may be a sign of colon cancer or polyps. Unlike the colonoscopy, FOBT and FIT are done at home. The sample is collected and sent to the lab. Neither test is very good at finding the source of the bleeding. Other non-invasive methods include CT colonography, also known as a virtual colonoscopy. This is a type of CT scan that takes detailed pictures of the inside of the colon. It doesn't involve inserting a tube into the rectum, but it may not be as effective at finding small polyps. Flexible sigmoidoscopy. This exam looks at the left side of the colon and rectum using a shorter, wider tube with a camera. It's not as commonly used for screening as a colonoscopy, but it's still a useful tool for diagnosing problems in the lower colon and rectum. Now let's discuss treatment. So what happens if colon cancer is diagnosed? Treatment depends on the stage, which is how advanced the cancer is and whether it has spread. Surgery. For early-stage cancers, surgery is often enough. Doctors remove the cancerous part of the colon and nearby lymph nodes. In many cases, this can cure the cancer. Chemotherapy. Chemotherapy is used to kill cancer cells. It may be used alone or after surgery to kill any remaining cancer cells that may be left behind. Radiation therapy. Radiation is more common for rectal cancer than colon cancer. It may be used to shrink a tumor before surgery or to destroy any remaining cancer cells after surgery. Targeted therapy. These are drugs that target specific proteins or genes involved in the growth and spread of cancer cells. Immunotherapy. These treatments use drugs that boost the body's immune system to fight cancer cells. New immunotherapy drugs show promise in treating advanced colon cancer. A question I am often asked is, what kind of diet should a person eat who has been diagnosed with colon cancer? Well, for that, I refer you to a previous video that I did. It covers the basic principles of a healthy diet. I will link it below in the description section. So let's talk about prevention. How can you reduce your risk of getting colon cancer? You can make positive lifestyle changes to lower your risk, even if you have risk factors. Eat a healthy diet, exercise regularly, maintain a healthy weight. Don't smoke, and limit alcohol consumption. Also, be sure to keep any follow-up appointments with your doctor. Attend all screenings and tests as recommended, and take medicines as directed, including colon cancer screening tests. Follow your screening schedule. Early detection is crucial. Remember, knowledge is power. Understanding your risk factors, recognizing the warning signs, and staying proactive about your health can make a significant difference. Please share this information with friends and family. Encourage them to prioritize their gut health and get screened. Together we can spread awareness and save lives. And lastly, I would like to say thank you for watching this video. Your support means everything to me. Stay healthy and take care.